was in college I started running, and I competed with my husband. We did biathlons, you know, where you run and you swim.
Today, long-distance runner and mother of 3, Patty Stull enjoys an active, healthy lifestyle. But there was a time when Patty's every step was an excruciating experience.
I had a lot of swelling, a lot of pain, and even to the point I wasn't able to stand up very long without having to lean against a railing or do something to take the pressure off my legs.
Patty, like more than millions of Americans, once suffered from the problem of varicose veins. Veins are the vessels that carry blood back to the heart.
And in the legs, that's particularly difficult because the veins carry blood uphill.
Normally, tiny one-way valves along the length of the vein regulate the flow of blood.
Gravity is always pulling that blood down, and the motion of the blood down the vein actually closes the valve. So the blood ends up walking up the leg like it's walking up a ladder.
When those valves along the length of the vein are leaking,
the blood wants to follow gravity and go downhill. And that's venous insufficiency or venous reflux.
And varicose veins are the painful and unsightly result of venous reflux. Other symptoms in the legs may include swelling, cramps, aching, heaviness, fatigue, restless legs, and skin discoloration. Severe venous reflux may even result in skin ulceration.
So the blood starts coming down under the pressure of gravity, and more blood occupies the vein so that it stretches, becomes dilated, and this is where we see the production of symptoms.
Risk factors include inactive lifestyle, pregnancy, standing occupations, and a history of blood clots and heredity.
We notice that if your mother or your father has them, then you're more likely to have them.
Pregnancy can also exacerbate the symptoms.
The last time that I was able to run or do anything like that with comfort was before my first child was born.
And while varicose veins are more common in older patients, they can occur at any age.
This patient is actually a college student who's a elite athlete in the discus and track and field. And as you can see here, he has some very large size varicose veins, probably more than 1/2 of an inch, if not 5/8 of an inch in diameter. Patients were often told, you don't need to do anything about it because it's just a problem with how the leg looks.
But to sufferers, the way their legs look runs a distant second to how they feel.
I felt like it was just crippling, not just my physical ability, but just mentally, just totally distressed that there was very little that I could do because of the pain in my leg.
I would say 80 or 90% of what we do here is not cosmetic. It's a bona fide medical problem that people present with.
A problem that, left untreated, can lead to serious health risks.
These veins are over 1 centimeter in diameter, and the blood through those veins flows very slowly and is certainly at risk for clotting. As you scan down the leg, you start to see patches of dark discoloration, and then down by the ankle, the skin has turned very dark, and that's all as a result of the ongoing pressure in the leg.
Severe complications such as venous ulcers can be debilitating.
The condition of one's legs is closely linked to the ability to stay independent.
Time's passing us by every day. We gotta be our best, always.
We're really on a crusade to get the word out that evidence of early venous disease is evidence enough to get care and get this taken care of before it's a problem.
And insurance companies understand that they need to be treated, and there's insurance coverage for the problem.
But the real revolution is in the realm of diagnosis and treatment.
There's been the really revolutionary changes in vascular ultrasounds, where we have very accurate imaging of vein problems. We can tell very precisely where the issues are, where the valve leakage is.
And once we were able to look inside of the leg, we were then able to understand what was going on.
The result of that new understanding has been radically improved vein care. For larger, deeper veins, treatment once called for a complex and often painful surgery known as vein stripping.
In the past, when patients were told, you'd have to come into the hospital, have general anesthesia, we're going to make some large incisions on your legs, and you're not going to be able to go back to work for 2 weeks, most patients said, I'm just going to live with this.
Now there is an alternative, venous closure.
The myth is that vein treatment is painful and there's a long recovery, and that's clearly untrue. And with vein closure, venous closure, we don't see that anymore.
Venus's patented closure technology can correct even advanced cases of varicose veins with a simple outpatient procedure performed under a local anesthetic.
What I'm going to do is numb up the skin along the course of the vein. So I want this to be a pain-free experience.
Following the local, a catheter is inserted into the vein.
It's very small and flexible. And this IV is already in the leg, so I'm just going to thread the catheter. And we'll use the ultrasound to make sure that I'm in the right place in the vein.
When in place, the catheter is heated via radio frequency energy and slowly removed from the vein.
So when we expose this vein to heat, which the patient can't feel because we put numbing medicine in, the heat makes the vein shrink down and close.
The procedure takes about 20 minutes. Most patients are in the office less than 1 hour and are able to return to normal activity immediately after the procedure.
Access to care has become so much better since the procedure itself has become more simple.
Sometimes venous closure does not completely eliminate all symptoms of varicose veins. For these patients, there is another option called ambulatory phlebectomy, which is the removal of varicose veins. Like venous closure, phlebectomy is done in the office under local anesthesia.
The beauty of that procedure is the patient's wide awake and very comfortable. And we're able to place very tiny little nicks in the skin once local anesthesia has been given. And we use a fine little tool to elevate the veins and remove them, and the patient doesn't feel a thing. Most often the patients are quite pleasantly surprised that they had no experience of pain, no sensation of the veins being removed. When they leave the office, they're smiling, happy, and able to drive themselves home without difficulty.
Phlebectomy can be combined with venous closure or performed by itself, and usually provides excellent cosmetic results without scars. Patients typically return to normal activity within 2 days.
They're back out on the tennis court, they're on the golf course, they're back doing their thing.
I'll be throwing the discus Monday and probably lifting right after that.
I'm driving myself home, and I just am thrilled about the entire process.
And the results speak for themselves.
And the success rate of doing venous closure approximates 98%. And because it's so easy to do, patients recover so quickly, and the results are so terrific, it's a clear winner.
This treatment has proven itself, and it's here to stay, and it has really just changed. It has improved the lives of so many people, and we've seen it here.
And 2 Frederick vascular surgeons are nationally recognized leaders in the use of this life-transforming technology.
We're one of the original users of the venous procedure here in the United States.
Dr. Paul McNeil, a board-certified vascular surgeon, has specialized in venous diseases for nearly 20 years.
We've always taken care of veins. We've always understood the problem, so we were able to get a high-volume experience early on. We're now taking the new solution to the patients we've always treated.
He's very engaged with his patients. He's very engaged in life.
And a true innovator when it comes to vein care.
We're one of the few vascular surgeons in the country that we spend 100% of our time taking care of patients with venous disease. And I think we've been very fortunate that we have assembled a great staff. Everybody enjoys what they're doing, and we all enjoy working closely together. I travel around the country to teach other doctors how to do this. So the impact that we have here in this office is actually felt across the country.
Dr. Garth Rosenberg, a fellow of the American College of Surgeons, has almost 20 years of experience in vascular surgery.
He's a pioneer in this, and he teaches this procedure, and he's done it many, many, many times.
A registered nurse, Cynthia Lowry suffered from varicose veins for 15 years before her procedure in 2007.
We have made some great strides in medical field, and I have to say this was one that certainly benefited me.
And now Cynthia tells everyone she knows about her life-changing experience at Capital Vein and Laser Center.
I would recommend this procedure to anyone and tell them not to wait and hold off.
Look into it immediately. Don't waste any time doing it.
You've got to go get the procedure, get it done.
Because Capital Vein and Laser patients don't just look better, they live better.
We make a great impact on the patient's quality of life, and the risks are minimal, and the benefit is tremendous.
My experience was just incredible.
Well, for the first time in probably 10 or 12 years, I wore shorts to the beach this summer, and my legs feel so much better.
I just feel like I've got new legs. It's great. I love it.
I feel having this procedure changed my life completely. Now I can be up and active. It's almost like I got myself back.
Good news about varicose veins.
I always had great legs, strong, fast, and they didn't look bad either. But then I developed varicose veins. My legs sometimes felt heavy and painful. I started to cover up and became less active. Then a friend told me about venous closure. It's minimally invasive, it can be done right in the doctor's office, and typically you can resume normal activity within a day.
Venous closure uses radiofrequency energy to shrink and close the vein, and most insurance covers it too.
Now my legs feel great again, and they look good too.
Call now if you experience varicose veins in your legs, because we have a solution that has worked for thousands. Call to schedule a consultation on the venous closure procedure.